Hi, a very good morning to Miss Anita and my dearest friends. I'm Devyani Ravichandran from DH22B. The topic I had choose for this case study is Psychology Peculiarities of Lifespan Development of a Female. On this topic, I have choose puberty as main topic. It is because puberty is the main development either on male or female after their childhood stage. So what is puberty? Puberty is the process by which a child's body develops into an adult body capable of sexual reproduction. It begins with hormonal messages from the brain to the gonads, the ovary in the female. The gonads carry hormones that increase libido as well as the growth function and changes of the brain, bone, muscle, blood, skin, hair, breast, and sex organs in response to the signal. Physical growth, which is height and weight, begin in the first half of adolescence and continue until an adult body is formed. The external sex organ, also known as primary sexual characteristic, are sex traits that identify girls before puberty. Puberty causes sexual dimorphism by causing the development of secondary sex traits which further differentiate the sexes. Girls typically begin puberty at the age of 10 to 11 and complete puberty at the age of 16 to 17. So there are five stages in puberty. First stages is adrenarche. Adrenarche is an early stage in sexual maturation and that happens in some higher primates and in humans typically peak at around 20 years of age and is involved in the development of pubic hair, body odor, skin oiliness, axillary hair, sexual attraction, sexual desire, increased libido and mild acne. During adrenarche, the adrenal glands secrete increased level of weak adrenal androgens. The second stage is gonadarchy. Gonadarchy refers to the earliest gonadal changes of puberty. In response to pituitary gonadotrophin, the ovaries in the girls begin to grow and increase the production of the sex steroid, especially estradiol and testosterone. In girls, ovary growth cannot be directly seen, so telarchy and growth acceleration are usually the first evidence of gonadarchy. Gonadarchy should be contrasted with adrenarchy. Gonadarchy indicates that true central puberty has begun, while adrenarchy is an independent maturation process only loosely associated with complete puberty. The third stage is telarchy. Telarchy, also known as breast budding, is the onset of secondary breast development, which often represents the beginning of pubertal development. It is the stage at which male and female breasts differentiate due to the variance in hormone levels. However, some males have a condition in which they develop breasts termed gynecomastia. Telarchy typically occurs between the age of 8 to 13 years old with significant variation between individuals. However, the initial growth of breast tissue occurs during fetal development regardlessly of sex. The fourth stage is pubarchy. Pubarchy refers to the first appearance of pubic hair of puberty. Pubarchy is one of the physical changes of puberty and can occur independently of complete puberty. Pubarchy usually results from rising level of androgen and not estrogen in females, and androgen in males from the adrenal gland, ovaries, or testes by may also result from exposure to an anabolic steroid. When puberty occurs prematurely, it is referred to as premature puberty or precocious puberty and may warrant an evaluation. Premature adrenarche is the most common cause of premature puberty. Early occurrences can arise due to congenital adrenal hyperplasia, androgen producing tumor of the adrenal gonad. When adrenarche, central puberty, and all pathologic conditions have been excluded, the term isolated premature puberty is used to describe the unexplained development of pubic hair at an early age without other hormonal or physical changes of puberty. The fifth stage is menarche. Menarche is the first menstrual cycle of first menstrual bleeding in female human. From both social and medical perspective, it is often considered the central event of female puberty as it signals the possibility of fertility. Girls experience menarche at different ages. Having menarche occurs between the ages of 9 to 16 is considered normal. The timing of menarche is influenced by female biology as well as genetic and environmental factors, especially nutritional factors. The mean age of menarche has declined over the last century, but the magnitude of the decline and the factors responsible remain subject of contention. So next, the physical changes that occurs in a female is breast development. The first sign in girls is usually a firm tender lump under the center of areola of one of both breasts, occurring an average at the about 10.5 years old age. By the widely used standard staging of puberty, this is stage 2 of breast development, where in stage 1 it is flat prepubertal breast. Within 6 to 12 months, the swelling has clearly begun in both sides, soften and can be felt and seen extending beyond the edge of the areola. By another 12 months, which is stage 4, the breasts are approaching mature size and shape, with areola and nipples forming a secondary mound. In most young women, this mound disappears into the contour of the mature breast, which is at stage 5. Although there is so much variation in size and shape of adult breasts that stage 4 and 5 are not always separately identified. Pubic hair is often the second noticeable changes in puberty, usually within a few months of telarchy. The pubic hairs are usually visible first along the labia. By stage 4, the pubic hair densely fill the pubic triangle. Stage 5 refers to the spread of pubic hair to the thigh and sometimes as abdominal hair upward towards the navel. In about 15% of girls, the early pubic hair appears before breast development begins. Next, perineal skin keratinized due to the effect of estrogen increasing its resistance to infection. The mucosal surface of the vagina also change in response to increased level of estrogen, becoming thicker and fuller pink in color in contrast to the brighter red of the prepubertal vaginal mucosa. Mucosa changes into a multi-layered structure with a superficial layer of squamous cell. The first menstrual bleeding is referred to as menarche and typically occurs about 2 years after telarchy. The average age of menarche is 12.5 in US. Most American girls experience their first period at 11, 12 or 13, but some experience it earlier than their 11th birthday and other after their 14th birthday. In fact, any time between 8 and 16 is normal. The time between menstrual period is not always regular in the first 2 years after menarche. So during this period, also in response to rising levels of estrogen, the lower half of the pelvis and thus hip widen, providing a larger birth canal. Fat tissue increase to a greater percentage of the body composition than in male, especially in the typical female distribution of breast, hip, buttocks, thigh, upper arm, and pubic. Progressive difference in fat distribution as well as sex difference in local skeletal growth contribute to the typical female body shape by the end of puberty. On average, at 10 years, girls have 6% more body fat than boys. Rising level of androgens can change the fatty acid composition of perspiration, resulting in a more adult body odor. This often precedes telarchy and puberty by 1 or more years. Another androgen effect is increased secretion of oil, which is sebum from the skin. These changes increase the susceptibility to acne, a skin condition that is characteristic of puberty. Acne varies greatly in its severity. In girls, estradiol causes thickening of lip and oral mucosa as well as further development of the vulva. In the vulva and vagina, estradiol causes thickening of the skin and the growth of both the myoepithelial layer and the smooth muscle of the vagina. Typically, estradiol will also cause pronounced growth of the labia minora. and to the lesser degree of the labia majora. Estradiol is also responsible for the increased production of pheomelanin, resulting in the characteristic red color of the lip, labia minora and sometimes labia majora. Estradiol, together with other ovarian steroid, also causes the darkened coloration of the areola. Changes of the vulva initiated by estradiol as well as its direct effect also appear to influence the functioning of the lower urinary tract. Last but not least, hair growth development under the arm starting out sparse before thickening and darkening over time. So, as a conclusion, puberty is characterized by a complex interplay of biochemical changes and the resulting physical maturation that lasts several years. There are numerous elements that might influence normal puberty advancement, and one should be knowledgeable not only with the physiology of normal female puberty but also with potential causes of atypical pubertal growth. The release of pubertal levels of sex hormones causes a variety of physical changes which are usually evaluated using the Tanner staging method. Estrogen has been shown to protect bone integrity, yet excessive estrogen exposure has been linked to endometrial health problems. And that's all from me. Thank you for lending your ears.